Yeah, just agree with Mueller self-adjusting knee brace. So this brace is made specifically for people that are having some kind of knee pain or some kind of problem with their knee. The idea here is that you put on the brace and it supports the joint, the surrounding soft tissues, and the muscles around the knee. And it'll restrict your knee motion a little bit. So that way your knee has a chance to rest, recover, and won't get so overstressed as you're doing things. So that'll help it heal and feel better. Less stress equals less pain. So a few points about this particular brace. It is one size fits most, so you don't have to worry about measuring your knee and getting the correct one. It does fit either the right or the left, which I think is really good because let's say your right knee's bothering you and you wear the brace, and then after a while your right knee's fine, but then maybe down the road your left knee's bothering you. Well, hey, you can still use the same brace. Don't worry about buying another one. The last thing to mention is it does have these self-adjusting tension straps that are supposed to give you the right amount of support, and those would be these here on the top and bottom. Okay. Anyway, other things you can do if you're having knee pain, I'm getting this from this book, Bulletproof Your Knee. If you have any kind of knee problems, make sure you're doing at least one exercise for your quadriceps muscle. Your quadriceps muscle is a big muscle on the top of your leg here. And here's your kneecap or your patella for reference. It's just above that. Made up of 4 different muscles, and collectively it's called the quads or the quadriceps. So what they're finding now, first of all, the quadriceps is a major stabilizer of your knee joint, so it's a very important muscle group. But when researchers go around, they look at people with various knee problems, they find that, and they test all the muscles around the knee, you're having just the quadriceps muscle is problematic, meaning that it's either weaker than normal, or if they do CT scans, they look at the cross-sectional area and they find that it's actually smaller than normal. No other muscles, just mainly the quads. So look at knee swelling in the quadriceps. Another study that demonstrated that even if you have as little as 20 milliliters of fluid in your knee, which is just over a tablespoon, it's enough to decrease the strength of your quadriceps muscle. So if you have any kind of chronic or acute swelling, it could actually be taking its toll on your quad strength. Knee injuries in the quadriceps, people like broken their tibia, surgical opening of the knee joint. So that'd be like if you had prior knee surgery in the past where they opened up your knee, could be at risk to have decreased quad strength. Ligament problems in the quadriceps, anterior cruciate ligament, also known as the ACL. You've heard of football players tearing their ACL. Look at this. One study looked at people who had ruptured their ACL and found that researchers found the strength of the quadriceps in the injured leg was decreased 25 to 30%. So here again, you're taking the big stabilizer of your knee joint and you're knocking it down, the strength 25%, over 25%, 30, over a quarter gone. It's going to be hard to get better and get pain-free unless you get that back up to normal. Posterior cruciate ligament, medial ligament, same thing. Knee pain. People have knee pain, they find it's associated with decreased quad strength. Knee arthritis. So if you Google like knee arthritis and quadriceps, you're going to find it's very, very consistent. That researchers find that when you have knee arthritis, they usually have decreased quad strength. And there are randomized controlled trials showing that if you take a group of people with knee arthritis, and you just strengthen their quadriceps muscle, that their knee pain starts to go away. And some of these studies are even finding that people with the strongest quads have the least progression of their knee arthritis. So that's really interesting. Patellofemoral pain syndrome in the quads. I mean, this goes on and on. If you have any kind of knee problem, make sure you're doing at least one exercise. Strengthen your quadriceps muscle. Fine-tune control over your knee. Here they're talking about the hip. Sometimes you have really bad knee pain. There's absolutely nothing wrong with your knee. It actually, the problem's up at the top here at your hip. So classic case is iliotibial band syndrome. Take a bunch of people with iliotibial band syndrome and you muscle test their strength of their hip muscles. Find they have unusually weak hip abductors. Your abductors keep your pelvis level every time you take a step. Also helps bring your leg out to the side. So here again, randomized controlled trials, just like with knee arthritis. Take a bunch of people with iliotibial band syndrome, and you strengthen just their hip abductors. Iliotibial band syndrome starts to go away. So that's interesting. Optimize knee flexibility. Here again, we all know that your knee needs to be able to bend and straighten sufficiently. What a lot of people don't know is that your knee actually rotates as well. About the last 10 to 15 degrees of extension, that's you straightening out your leg, your knee actually rotates laterally or out to the side. So here's a test to see if you have that motion. And that's an accessory motion that you really need to have a fully functioning knee. So that's letting you get back to stretching. Another last thing, increased dynamic knee stability. Here they're talking about proprioception. Proprioception is, well, let's say if I suddenly turn off the lights, it was pitch black, you'd probably be able to tell me if your knee was bent or straight, and that's your proprioception. That's because you have these receptors in the knee joint and the surrounding soft tissues, like your muscles, and they give your brain constant feedback as to where your knee is in space. So that's your proprioception. So what they're finding is that they take people with various knee problems, and researchers test their proprioception. They find if you have a knee problem, a lot of these people have problems with their proprioception. Now it's not like they don't know where their knee is. It's just that it's not up to where it's not normal. It's not what it should be. So that's something you can actually improve with an exercise or two. But hey, nothing's as quick as putting on a brace. This is a good one, so check it out.